Increasingly, we're realizing that our lifestyles are crucial to our long-term health. We know the health inequality gap is increasing, but despite all of our best efforts, in certain cases, some patients are still slipping through the net. Finding and supporting these patients can help them improve their lifestyle and their overall health for years to come.
I've got type 2 diabetes and I was diagnosed with it around 10 years ago.
I've also got type 2 diabetes. I was diagnosed probably about 8 years ago.
Some groups of patients aren't responding to our standard one-size-fits-all approach to support them to improve their health and lifestyles. Within Berkshire West Integrated Care System, we're working very closely with partners in health, social and the voluntary sector to bring data together in a new way.
There are quite devastating consequences with type 2 diabetes, which can sort of cause premature death. So those are things like heart disease and strokes. So it's really important to intervene early so we can prevent these complications from happening.
We used to have to go to the GP surgery once a year for a review meeting. We were told when we needed to go in. We'd get our medication assessed and our blood sugars assessed, and we would be prescribed new medication. We were told what was the right thing for us, what was the right medication and how we should behave and what we should and shouldn't eat. And there wasn't a lot of two-way dialogue.
If I'm honest, I'll say that our approach to it, when mine definitely was, I've got this, but I can take some tablets, I'll take the pills and crack on.
We were gradually deteriorating. Every year the medication would be stepped up a little bit and I could gradually see the blood sugars rising.
The key to this is data. Coming together as a system provides us with the opportunity to join up data from health and social care to support and help GPs with hard evidence to proactively design interventions for patients who really need the care.
We identified a group of patients with type 2 diabetes that did seem to be slipping through the net, and we went out and we asked them why this was the case.
Dr. Alton called us and had a long conversation with us about a potential group session. And it was really great to have that personalised approach where he was keen to understand what would work for us rather than just being the medical professional telling us what the right answer was.
So we had a 1.5 hour group session. It was quite a casual setting. We were able to divulge lots of information in a detailed fashion to a large number of people.
We felt like we were having a conversation with somebody that was interested in getting a plan together involving all of our things, not just what we ate and what our sugar levels were.
I think we both walked away from that with a much better understanding of why things happened, how they worked and how we could work in tune with them.
So the beauty of this approach is it offers local solutions to local problems. We have the analyst support to be able to interrogate the data we now have available to really pin down which groups we need to support better.
We've taken dairy largely out of our diet. We've cut back on bread. We're eating a lot more fish, salad, and a lot of nuts and porridge. We've also upped our exercise, so we're doing a lot more walking.
The change in the bloods was immediate, almost from our finger testing. We could see, like, really within 3 days, how quickly that had started to show results, which was very encouraging.
We're less reliant on the medication to keep them low. It's controlled as much by the diet as the medication.
For me as a GP, this offers a way of providing a different service that is tailored to our patients that we know will work.
It's effective because it's a personalised treatment plan for a patient. It's completely tailored to them.
I think the long-term benefit of population health management is the predictive element. The analysis of the data today allows us to predict the future health needs and demands of future patients.
Population health has been around for a very long time, but what we have now is much greater integration within systems that we can utilise to adopt this very logical approach to how we improve the health and well-being of our population health.